Hello, everybody. My name is Christine Velasquez. This is my change in quality management project, and it is on preventing surgical site infections. Issue identification. Surgical site infections are infections that occur as a result of the introduction of bacteria from a surgical procedure. Surgical site infections can sometimes be superficial infections involving the skin only. Other surgical site infections are more serious and can involve tissues under the skin, organs, or implanted material. Surgical site infections have become a quality safety measure on the HCAHPS score, by which hospitals are deemed eligible for their Medicare and Medicaid reimbursement. This has aided in making hospitals ensure safety guidelines and standards of practice are put in place that aim to prevent surgical site infections. Quality variance. Many variables are considered in determining how a patient developed an infection, especially in regards to outpatient surgical procedures whose home conditions are not thoroughly known. In order to account for the variance in outside patient variables, nurses must assess their patients prior to surgical procedures. Surgical plans of care are modified based on that assessment. So, for example, they may choose to use an anaphylactic antibiotic if they do have, if they have a higher risk of getting infections. More importantly, standards have been adapted in order to prevent surgical site infections in any patient. Standard precautions include administration of prophylactic antibiotics, proper sterilization of instruments, effective skin prepping prior to surgery, ensuring no retained foreign bodies during surgery. So we have specific protocols that we follow in the OR in order to prevent leaving any foreign bodies in the patient, because there actually has been cases of that are well documented, well known. Root cause analysis. The root cause of surgical site infections is sought out through documentation of the patient's condition prior to the procedure, important events that took place during the procedure, and documented care after the procedure. For example, patient risk factors are well documented prior to the procedure. The type of skin preparation is documented, and sterilization indication strips are used in every sterilization cycle of instruments. So in every instrument tray, we have an indicator that shows that it ran through the sterilization cycle, usually in the autoclave. Patient education is also well documented to ensure that patients understand how to care for their surgical site when they go home. A lot of times, patients are told not to shower for the next 2 days because adding water will actually breed a lot of bacteria in that surgical site. So they usually inform patients not to do that. If any surgical site infection is reported, the case is audited in order to investigate whether the infection may have come from, where the infection may have come from. So here I have a table, and it's risk factors for developing SSIs, or surgical site infections. So there's patient risk factors, things that we can't control that the patient comes in with. So for instance, their age, their nutrition status, diabetes, whether they smoke or not, if they're obese, if they've had other infections or currently have an infection, colonization of certain bacteria on their surgical site, immunosuppression, or the length of stay inside the hospital. Then operative risk factors include the duration of the surgical scrub. So when we prep, there's a certain amount of time that we have to have that solution on the patient's skin. And then there's a certain amount of time that we have to let it dry as well to prevent fire. It's a fire safety. So skin antisepsis, preoperative shaving. Shaving actually, if we nick the skin, can cause like an entry point for infection or bacteria. Preoperative skin preparation, duration of operation. The longer the operation, the more likely, the more at risk the patient is for developing an infection. Antimicrobial prophylaxis, operation room ventilation. So we have very strict rules on what temperature and what humidity the operation room can be. Inadequate instrument sterilization, foreign material in the surgical site. So we always do counts. We do multiple counts throughout the operation to ensure that nothing is left behind in the patient. If the patient has a surgical drain that's placed, surgical technique, including poor hemostasis, meaning if blood was controlled, stopping the patient from bleeding too much, got to make sure that was taken care of during the procedure. Failure to obliterate dead space. So sometimes in laparoscopic cases, they will use gas to inflate the abdominal cavity. And so afterwards, you have to make sure that that is going down, get rid of all of that gas. Also, when they're closing up different layers of tissue, you have to make sure that everything is being accounted for and you don't leave a lot of dead space. And tissue trauma. So scope. The surgery services department manager is notified of incidents of surgical site infections of patients who have had surgery in our department. The OR manager then investigates how the surgical site infection may have developed, whether it was caused by unsterile instruments from improper surgical site preparation, a failure to administer prophylactic antibiotics, so on and so forth. So based on this information, appropriate changes are made within the department to prevent surgical site infections. I'll get to what we actually have implemented at my hospital. This information came from a surgical services meeting held in July. And solution. The National Healthcare Safety Network has established a surgical site infection surveillance program, which tracks when patients develop surgical site infections. So there's actually these programs that exist that every hospital has to comply with, and this goes hand in hand with the reimbursement program from the Center for Medicaid and Medicare Services. So up to 60% of SSIs have been estimated to be preventable by using evidence-based guidelines. Using trending data, the surgical services team investigates the cause of the infection and implements a change in current protocols, such as implementing stricter disinfection techniques. In our hospital, what we've done, we've removed Cydex disinfection solution and currently attempt to run all instruments in the autoclave instead. So as you can see on the side, that Cydex bottle, it's this very harsh chemical that is actually used to sterilize things. It's blue in color. You might have seen it in like barber shops. They usually disinfect their instruments there. It does work. However, it is not as good at disinfecting and sterilizing instruments as running things through our big machine, that the autoclave that is used solely for that purpose. So in our hospital, what we've done was try to get rid of the Cydex. And if there's anything that needs to be run very quickly because we have a quick turnover, or because we have, say, a lot of the same cases and we need to sterilize these instruments between cases, we have another machine that does it, that basically has the same components of the autoclave, but it's done a little bit quicker. So we're trying to implement the use of these machines rather than using the solution, only because the solution is not as good as the machine. Another thing we implemented is the use of the chlorhexidine gluconate wipes prior to surgical preparation solutions. So we do have something to prep patients on the side of the operation. However, this is like an added thing before we even prep them and completely use a asepsis technique on that site. We will wipe them down, and we can actually wipe their whole body, not just the site that's going to be operated on, but basically everything, to try to prevent bacteria from growing on the patient during the procedure, to try to prevent surgical site infections. So we have been using these a lot, especially in our C-section and our orthopedic surgeries. The solution implementation. All OR staff are expected to comply with surgical services protocols. Monthly meetings are held to inform staff of our progress in implementing new standards and to answer any questions or concerns in doing so. Competencies are also implemented in order to ensure all circulating nurses are able to perform required patient safety tasks. So all of the RNs have to be competent on all of these practices that we put in place to prevent surgical site infections. And we have more than one way of making sure that everybody is aware and everybody is complying. Analysis. Data is collected via the documentation of the intraoperative record. This record details the patient's prior conditions before surgery and populates the patient risk level of obtaining a surgical site infection. The intraoperative record also contains information on what type of prepping solution was used, whether the patient had to be shaved, and what wound level the patient received from surgery. So surgical wound levels determine whether the area that is operated on is clean or dirty, and therefore at a greater risk for infection. So basically with that, I think I have it on the next slide. We can actually look at whether they already have an infection, which make it the surgical site a dirty wound, or if they actually have no past medical history of any infections, of any problems, they don't have diabetes, they don't have anything that puts them at a greater risk for infection, then their wound level would actually be level 1, which would be, a clean wound. Also, this quarter, our Cydex solution was used for only 9 cases, and nurses had chlorhexidine gluconate compliance rate of 76% for cesarean section cases. So we're pushing to hit that 100% compliance rate. That's something we're working on moving forward. Next steps. Moving forward, our surgical services department would like to purchase enough instruments to prevent the use of Cydex for a quick turnover. We are also looking to attain 100% compliance of chlorhexidine gluconate wipes used in cesarean section cases. And we hope that adding and maintaining these practices, along with the protocols already in place, will prevent surgical site infections in the future. Here are my references. Thank you, everyone.